Objective data 304. Family history. Following the past medical history, the family history is documented. The family history should include pertinent negatives as well as positive findings. Broad categories that are usually explored in this section include a family history of cancer, diabetes, cerebrovascular accidents, myocardial infarctions, and genetic defects. Within each of these categories, it is appropriate to further explore positive findings. For example, if a patient has a family history of cancer, the clinician should document the type of cancer and which family member. For cardiovascular diseases, it is also appropriate to document the family member's age at the time of the event. For example, it makes a difference in terms of cardiovascular risk factors if a patient's father had a myocardial infarction at the age of 54 and died from it, or whether the father had a myocardial infarction at the age of 84. In some cases, a genogram may be included. The genogram provides a rapid way to condense the data and indicates whether immediate relatives are alive or have died, and what type of comorbidities each individual has or had. Symbols are used to represent family members when developing the genogram. An open circle refers to female relatives. An open square represents male relatives. If either the circle or square is colored in, it indicates that the individual is deceased. Lines are used to indicate both marriages and children, and a broken line indicates a divorce. In developing a genogram, it is important to indicate the patient's position within the genogram with an arrow. So here we have a patient who is a 45-year-old man who has hypertension and diabetes mellitus. He has 3 siblings, 2 sisters and a brother. One sister and his brother have DM. The patient's parents are alive. His father has hypertension and DM and is 68 years old. His mother is 66 years old and has had breast cancer. His aunt is age 67 and alive and well. Maternal grandparents are both dead. His grandfather died in a motor vehicle accident at age 46, and his maternal grandmother died of a stroke at age 78. Paternal grandparents were divorced. His paternal grandfather died of a myocardial infarction at the age of 62, and his paternal grandmother is A and W. Thank you for your attention.